Having breast cancer is obviously an enormous shock to most women. They often find a lump, go to their GP, and very quickly get diagnosed of having breast cancer. So it's a bit of a whirlwind, and then they may end up having either a wide local excision or mastectomy, which itself is a large operation and leaves them with a disfigurement. I think reconstruction really is a process, it's a surgical journey that helps them get over the fact they've had a diagnosis of breast cancer and makes them whole again in terms of their physically, mentally, and in terms of their sexuality as well.
I think everyone, if they want it, should have reconstruction. Lots of women don't, and I think it's a great pity, because when you've had your body mutilated, you want it to look lovely again. Well, I did.
The reconstruction is a way of giving them something back, starting a positive pathway to rebuild what essentially has been taken away from them, and can enable them to get back with their lives, on with their lives. And many women use the phrase, the old me is back, once their reconstruction is done. They feel that a piece that was missing from them has now been restored.
I thought it would be better to be living with two breasts for the rest of my life rather than just one. And I understood that the success rate was very high, so give it a go.
There are national guidelines as well. NICE says that every woman who has a mastectomy should at the very least be offered a consultation for breast reconstruction. I think it's the completion of the process. From a woman's perspective, what I have heard from my patients is that after a mastectomy, wearing an external prosthesis can be quite demanding, in the sense they find clothes that are difficult to fit. Sometimes when they're out shopping, the prosthesis might fall out. They have to be careful they don't wear low-cut tops. So for all those reasons, most women will probably find it quite useful to have a breast reconstruction, and it makes her feel complete.
And it's great, you can wear what clothes you like, you know, you can wear what underwear you like, you can have a cleavage, fabulous. You're confident on the beach, everywhere.
Walking past a mirror, they're not constantly reminded of the cancer they've had and that's been removed via a mastectomy or wide local excision. They have formed their shape, they're able to wear the clothes they want to, and it really gives them a boost physically, mentally, and in terms of their sexuality as well.
Before I had cancer, I wasn't always happy with my body shape and would avoid looking in the mirror at myself naked. But now, since having the reconstruction done, I find I'm quite happy to look at myself naked, and often I will look at my breasts and think, wow, you know, these look rather nice.